growth in this particular model. Nasal placoid is sunk into the mesenchyme, forming the nasal pit, and when that occurs, you get the formation of the medial nasal prominence and the lateral nasal prominence. So there's the lateral, there's the medial. You see, okay? There's the nasal pit. There's that developing eye, not very well placed in this particular model. There's the maxillary process beginning to grow over towards that medial nasal process. There's the mandibular swelling or process. There's the second arch, or the second arch right there. There are the auricular hillocks. So that is going to become the external auditory meatus. So these are going to grow. The two medial nasal processes are going to grow towards the midline and fuse right along the midline. Maxillary process is also going to grow towards the midline and fuse with the medial nasal processes. So if we look at the next model. There's the maxillary process. Here are the medial nasal processes fusing along that midline. There's the lateral nasal process. We still have a cleft right there. But right there, that's the nasal lacrimal groove, which becomes the nasal lacrimal duct. So it'll sink into the mesenchyme as a cord and then become papial. So there's that maxillary process continuing to grow over to meet the medial nasal process. It also will fuse with the lateral nasal process, but that will have nothing to do with any sort of malformation, such as a cleft lip. There are those auricular hillocks again. External auditory meatus forming right there, and there's that developing eye. And as you can see right there, we have a corneal lesion. Okay. The gray lump down there, that's the heart bulge. And if you look at that one dendro slide of the branchial arches, you can see the developing heart inferior to the arches as well as the developing liver.